So today we'll begin a simple primary care review on gestational diabetes mellitus. Gestational diabetes mellitus is a pregnancy complicated by diabetes mellitus. Screening for gestational diabetes is at 24 to 28 weeks of gestation. GDM increases the risk of preeclampsia and macrosomia. Short-term complications of GDM are LGA, preeclampsia and gestational hypertension, polyhydramnios, stillbirths, neonatal morbidity. Long-term complications include maternal development of type 2 diabetes, diabetes-related vascular disease, increase in the risk of developing obesity and diabetes, and lastly, poorly controlled maternal diabetes during pregnancy may affect neural development in the infant. Glucose control is important in lessening the risk of complications. So you would have a fasting blood glucose concentration of less than 95 milligrams per deciliter, a 1 hour postprandial blood glucose concentration of less than 140 milligrams per deciliter. And for the 2 hour postprandial glucose concentration, it would have to be less than 120 milligrams per deciliter. Fetal monitoring for an A1 GDM with diet control, the management would be the same as a normal pregnancy. For an A2 GDM with glucose control medication, NSTs twice a week, plus an amniotic fluid index beginning at 32 weeks of gestation would be necessary. Fetal growth monitoring. An ultrasound examination at 36 to 39 weeks to estimate fetal weight would be necessary. Times of delivery for an A1 GDM with good glucose control can schedule an induction between 39 to 41 weeks of gestation. A2 GTM and A1 GDM with suboptimal glucose control can schedule an induction of labor at 39 weeks of gestation. While lastly, scheduled cesarean delivery would be necessary at 39 weeks if GDM is present and estimated fetal weight would be greater than or equal to 4,500 grams. Postpartum management, breastfeeding can benefit both mother and child, and diabetic screening would check fasting glucose in 24 to 72 hours after delivery to exclude ongoing hyperglycemia. If the fasting glucose is greater than or equal to 126 milligrams per deciliter, or postprandial glucose is greater than or equal to 200 milligrams per deciliter, treatment of hyperglycemia is warranted. Thank you.